the vaccine, while it is still quite good at preventing the transmission of Delta, Delta is just that little bit better at transmitting. So we're still seeing great figures with regard to preventing severe disease and hospitalization and death, but certainly transmission can still occur. So it's really on all of us to make sure we're still following those public health measures that we've been following right through the whole pandemic.
Thank you.
We will now go to the phone. Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Good afternoon. I'm wondering whether public health is on track, as I was told last week, to offer new guidance on choral and wind instrument playing, choral singing.
Yes, so we have looked at that, and I believe some guidance is moving up through the approval process right now. It's already passed by my desk, so it should be coming out very shortly.
Okay. And the other question I have is, will there be some, given the nuances of singing, etc., will there be any revisiting of the physical distancing requirements?
So at the moment, physical distancing is still recommended, and as much as is possible. And we do know that if there is a case of COVID in a situation, in a choir practice or something like that, it can still spread. So that, reducing the physical distancing, if it's going to spread, it can still do it even if someone is vaccinated, I guess is the point. So, we would still recommend trying to physically distance as much as possible. And if that was not possible, for people to consider obviously wearing masks to reduce that risk.
Okay, thank you.
Our next questions are from Richard Duggan with VOCN. Please go ahead.
Good afternoon. Last week, the province released its back-to-school plan, and they say that it will be public health that will be determining if a situation is low risk versus high risk. So, Dr. Fitzgerald, what criteria will you be looking at in making that determination?
So we've outlined that in the plan, actually. If you look in the appendix of the back-to-school plan, the public health guidance is there, and it does explain what high risk and low risk would be. And so basically, low risk is low epidemiology, no spread of virus, or very, small amount of spread of virus, and good vaccination rates. But if we had to see a situation where we had a rapidly increasing spread or transmission of COVID-19, or if we were to have a situation where there were low vaccination rates in that context of increasing spread, if we were to suddenly see a variant that had vaccine escape, so was not showing susceptibility to the vaccine, or if we had an outbreak in a situation where we might have low vaccination rates or concern about a vulnerable population who may not form a great immune response, thinking like, long-term care facilities where you may have some people who are frail and elderly. So those are situations that would make it high risk. So there's no, we don't want to sort of set down, in exactly this situation it's going to be considered high risk, because this will be a very fluid thing, and what the number of cases in one situation may not actually be high risk, but in another situation, depending on vaccine rates, depending on what the population is that's infected or where we're seeing the transmission, it might be considered a high-risk situation. So it's certainly something that will be fluid and we'll be looking at. Public health certainly will be making those assessments as time goes on, but those are the things that we'll be taking into consideration when we're making those assessments.
And public health has been making the push for those in the 12 to, 18 year-old category to get vaccinated ahead of the beginning of school in a couple of weeks' time. Wondering if there are any numbers related to how many people in that age group have been vaccinated to date, And now that we are 3 weeks away from school starting, are there any concerns with the vaccine uptake for that age group so far?
So right now, in that age group, just give me 1 second, we have over 80% of that population has received at least one dose, and just over 55% have received 2 doses. So certainly we would like to see that that number for second doses up a little bit. I think a lot of people were trying to wait as long as they could between doses before the start of school to try to ensure that the immune protection was the best that it could be to give the best immune response. And so they were probably waiting until the middle of August to be able to have that 2 weeks leeway. So I expect over the next couple of weeks we'll start to see that number increase a fair bit. But we're very pleased with seeing that over 80% of the population right now has gotten 1 dose, and that's a good marker, I think, for people wanting to get the second.
Thank you.
I'll now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV, do you have a final question?
Yes, thanks, Leslie. Dr. Fitzgerald, I know I've asked in the past a lot of travelers wanting to know if there's an opportunity for them to get a 3rd shot that will match. I know the push right now is to get as many people with the 2nd dose, but people who had AstraZeneca for their first is where primarily the questions are coming from. If those opportunities will be there, and if we have to meet a certain threshold for 2nd doses for that to open up for them.
So I think at this point, our goal, as I've said before, the goal of our immunization program is really to get as many people protected in our province as we can. And we know that 2 doses are what we need to do to make sure that happens. So we're really focused on 2nd doses right now. We don't have any plans to offer 3rd doses at the moment with regard to people who've had the first dose of AstraZeneca. I think as time goes on, what we have to remember, number one, if you're traveling within Canada, it's not going to be an issue. And there are more and more countries who are actually looking at the mixing of doses right now and are considering things. So I think as time goes on over the next several months, we will, and by the time most people will be thinking about traveling, because we have to remember there is still, Health Canada, Public Health Agency of Canada are still not recommending travel internationally. By the time we get to a point where most people will be wanting to travel, I think we will have the answers to those questions. So as I said in my speaking notes earlier, the most important thing right now is just to get vaccinated with 2 doses. And if you're deciding to wait, you are taking a risk.
Meg Roberts with CBC, do you have a final question?
Yes, I do. I was just wondering, with the mask mandate being dropped, how do you think that's going, and do you foresee any changes?
So, I mean, I will admit I don't get a lot of time to go out, but when I have gone out and been out around, certainly I see most people still wearing their mask, which I think is really good. We still recommend that people wear their masks when they're in public places, and especially if you're in a situation where you can't physically distance, or you're not really sure if you're going to be able to physically distance, or that's going to be variable while you're there, and especially if you don't know people's vaccination status. So we're still recommending it. At the moment, we're continuing on as is. As we've always said, if anything changes, if our epi changes, if the evidence changes, then we'll certainly pivot to respond to those changes. And if we start to see an increase in cases in a certain area, it may very well be that we recommend masks, or that we mandate masks in that situation. But at the moment, of course, we're staying where we are.
Thank you.
Peter Jackson with the Telegram, do you have a final question?
Yes, sorry. Just one quick one. Can you clarify again under what circumstances a fully vaccinated person would still have to isolate with respect to this contact tracing that's going on?
Yes, so certainly there are some people who may work in higher risk areas where we would still ask them to self-isolate. And that's really more to prevent spread into those higher risk areas. if they're a contact. And then there may be situations where somebody is has 2 doses and we would consider fully vaccinated, but if they're in a situation, if they have medical conditions where perhaps they're immune compromised and may not be able to form a great immune response, then we would ask that they would isolate just because they're at higher risk of contracting disease. If there was a situation where we had someone with an active symptomatic COVID case in a household and you weren't able to isolate away from that person, so you're having continued exposure to active COVID disease, even if you're fully vaccinated, in that situation, you will likely be asked to self-isolate.
Thank you.
Richard Duggan with VOCM. Do you have a final question?
Yes, Minister Haggie, in your opening remarks, you said that you've noticed vaccine distribution has been patchy in some areas of the province. Why do you think this is? Is it an issue of access to clinics, for example, or is it people making the choice not to get the shot?
That's an excellent question, and really the answer is pure speculation. So I don't have a hard and fast answer. I do, however, believe very clearly that in the case, the areas I mentioned, that the health authority there has been extremely diligent in making access to vaccination, both on a walk-in basis and on an appointment basis, a priority. So I would be very reluctant to suggest that was the cause. I honestly can't give you an answer because I don't have one.
Thank you.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, just one really. If you haven't had your first or you need your second shot, go get the shot. Having you protected keeps us all protected. Take care.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.